All right, it's good to have you back. Let's bring you this now. Indian Prime Minister, that's Narendra Modi, is becoming increasingly under pressure to impose a nationwide lockdown. COVID-19 cases in the country continue to surge, with between 300,000 to 400,000 cases being reported, and this is daily. Now, the World Health Organization has labeled the mutation dominant in India as a variant of concern, and Chief Medical Advisor to U.S. President Joe Biden, that's Anthony Fauci, says that the country needs to be shut down at this point. So let's get the very latest from our India correspondent, Bundhun, who joins us now from Mumbai. Rebecca, good to have you, and good morning from this side of the world. Let's start with this, where we're seeing that the Prime Minister is receiving quite some pressure here to impose a nationwide lockdown.
That's absolutely right. There's growing pressure coming from all sides now. It's coming from health specialists, doctors, even industry, the opposition parties as well. They've been calling for this nationwide lockdown. And even Dr. Anthony Fauci, the White House chief medical advisor, has weighed in on this and said that India really needs to shut down for a few weeks just to break this chain now, because India is obviously still in the midst of this COVID-19 crisis where hospitals are continuing to be overwhelmed. They're struggling with these oxygen shortages of medicine. It's still very difficult for people in parts of the country to get access to a hospital bed, given this massive second wave of infections that the country is seeing. And the latest figures have just come out this morning, and there's some slightly encouraging signs, because the numbers have actually dipped a bit to just over 329,000 cases in the past 24 hours, confirmed cases, but that's obviously still incredibly high, and more than 3,800 deaths, which is also very high as well. So the numbers are still concerning, but at least they have come down from those numbers that we were seeing over the weekend of more than 400,000 cases a day. But doctors are still saying we have to wait to see when the second wave is going to peak. They're hopeful that it will start to peak in the middle of this month. But really, the crisis is still ongoing. International aid is continuing to come into the country, but India is still struggling with this huge second wave, which has really hit the country very hard and its healthcare system.
Yeah, absolutely, Rebecca. I think at this point, the entire world is concerned with what's happening in India, with some even dubbing it, the COVID-19 tsunami there, just based on the numbers that have been reported. But I want to come to this. I mean, we know that India has been dubbed also the world's pharmacy, dispatching approximately 16 million vaccines of the AstraZeneca vaccine to the world, but it seems they have to suspend, this dispatching of vaccines just so to at least meet their own needs at this point.
Yeah, the vaccination drive has been an ongoing struggle for India, because India is the world's largest manufacturer of vaccines, but it's come as a surprise that India has been facing these vaccine shortages. It's been quite difficult for a lot of people recently to get access to the jabs, and the country's only fully inoculated about 2.5% of the population. And again, experts are saying that this is really going to be one of India's main ways of battling the pandemic, along with something immediate like a lockdown, which the Indian government, Prime Minister Narendra Modi, is actually resisting, because he worries about the economic impact of a lockdown. If we look at what happened last year with migrant labourers being hard hit, the country being plunged into recession, although we are seeing several states that have introduced their own lockdown restrictions, including in Mumbai and the state of Maharashtra. Delhi's also just extended its lockdown. Tamil Nadu has introduced its own local curbs. But otherwise, in the longer term, the vaccination drive is really seen as key to India battling this pandemic and overcoming it. And yet the pace of vaccination has been incredibly slow, really, and there's been a lot of criticism of this, especially given India's role in actually producing vaccines. And now it looks like India will have to increasingly turn to imports of vaccines, and that's something that it's starting to do at the moment. And hopefully, it's hoped that this will be ramped up over the coming weeks as it continues to battle this huge second wave of the virus, because doctors are saying that could really be the way of trying to avert or alleviate a third wave, which everybody's now worried about.